Hi, this is Drew with McCormick Agency of Healthcare Solutions team. Today we're going to go through some of the basic parts of Medicare, which can also be the most confusing. It's supposed to be the easiest, not necessarily always the case, and that's the ABCs of Medicare. So there's a whole alphabet of letters that get thrown at you when you become eligible for Medicare. None of it's similar to what you're used to either through your employer or what you had prior to turn 65. So it's confusing. I get it. It took me a long time to figure it out myself. So let's start with part A and kind of work our way through. So part A is what you get when you turn 65. It covers inpatient hospital services. So basically anything done through the hospital would be covered under Part A. Part A, you don't necessarily have to elect. You just get it as being a tax-paying citizen. And you get it when you turn 65. So once again, Part A covers hospital services, and you get it when you turn 65. Or the other way you can become eligible for Medicare is if you've been on disability for at least 2 years before turning 65 is the other way, but that's kind of a different topic that we won't get into in this video. We'll get into Part B is the next part of Medicare. Part B picks up outpatient hospital or outpatient services, so doctor's visits, your preventative services, chiropractic can be covered under there, mental health services can be covered under there. So anything medically necessary not done at the hospital would be covered under your Part B. Next part is Part C, which is also known as Medicare Advantage, which we'll cover that in a different video. It's kind of its own animal, so to speak, but basically what Part C is it replaces A and B, which is also referred to as original Medicare that you get from the government. It replaces A and B and outsources it to a private insurance company like United Healthcare, Aetna, Humana, are just a few examples. So that's Medicare Advantage, which is Part C, which once again replaces your original Medicare, which is A and B. Next part is Part D, which is the prescription portion of Medicare, and that was also through a private insurance company, not covered by original Medicare, once again, A and B. And the Part D is also a video, or I'm sorry, a topic we'll go into in a deeper conversation in a different video. But Part D picks up your medications. So or I should say, medications not used like a hospital, for example. Medications you fill at the pharmacy, for example. So if you go to Walgreens, CVS, or whatever, mom and pop pharmacy, that's when you would bring your Medicare prescription card. Once again, your Part D that covers your medications. So that's your A, B, C, and D of Medicare. Now there's a whole alphabet of letters like G, F, N, for example, of Medicare supplements, also which I've got some other videos out there on the Medicare supplements that'll pick up what A and B, original Medicare, which is the government does not pick up. So those Medicare supplements are also known as Medigap plans. You may have heard of that term. They're interchangeable, one and the same. Medicare supplement, Medigap means the same thing. So don't get confused by the different terminology there. And within the Medicare supplements, most people stick within the three that I mentioned. F, if you're still eligible, which a lot of people aren't any longer. G is most popular by a pretty significant margin. And then also N is the kind of last supplement that are at least of the top three, in my opinion, for the Medicare supplements. So that's kind of a quick rundown of A, B, C, D, and then a little bit into the supplements. Hopefully this gives you kind of a good quick rundown of what these different parts represent. Check out my other videos for kind of more deep dive into those, and if you got questions, that's what I'm here for. So thank you.